Hello my dear students. Today we will discuss about the homeostasis, components and type of the feedback system. Homeostasis, as the word says, homeo and stasis. Homeo means same, status means balance. It means our body want to balance in each and every aspect. Either it's an external environment, or it's an internal environment, or different or other social factors also. Means I want to say that homeostasis is the mechanism in which our body is maintain stability. But the thing is that why it needs so? Because our body is continuously being disturbed. What are the factors which disturbed our body? There are different factors like external factors like very much heat outside, very much rainy outside, very much cold outside. These are the external factors. Second, internal factors. Internal factors means your body will internally having some disease, so your body try to overcome these factors and try to maintain its balance. And other factors, these are the social factors. Okay, so here the need of homeostasis is because our body is continuously being disturbed. So I am writing here, human body is continuously being disturbed. So our body want to maintain the stability to overcome such external, internal, psychological factors. So here I have written one definition, one line definition. Homeostasis, it means ability to maintain internal stability. It means our body wants to maintain complete proper system, either the temperature aspect, either the blood pressure aspect, either the glucose level aspect, either the any other hormonal aspect. So such kind of the internal stability can be maintained by the different factors. We will discuss those factors in other lectures. But here the homeostasis is the maintain the internal stability. So one question comes in your mind that these factors comes which provoking our body for being disturbance. So these factors comes from external environment, internal environment and social environment. So disturbing factors I am writing here. Disturbing factor here. So these disturbing factors are first external environment, or you can say external factors. Second, internal factors. And third one, psychological factors. So here external environment is what, as I have told, that if there are too much heat outside, it means these are the external factors which initiate your body, which initiate the homeostatic mechanism in your body. So here the external factors are like heat, temperature, high temperature, cold, if the temperature is in -20, -10, okay, so that temperature is very cold and your body initiates such mechanism to maintain your body temperature. So here some external factors are there, but The internal factors are generated by your body itself due to some disease or other causative agents. Internal factors are like that: high blood pressure, low blood pressure, high glucose level, low glucose level. So such internal factors are developed due to many reasons. We will not discuss here the why the blood pressure will go upside, why the blood pressure go downside, why the glucose level not in the normal position. So that we will not discuss here. I am just discussing about the factors which will initiate your body, the homeostatic mechanism. So internal factors are generated by your body environment, internal environment itself, like for example, high glucose level, low glucose level, high BP. BP means blood pressure. Okay, so these are the internal factors. There are so many internal factors. I have written some one only. Okay. Next, the third one, that is the psychological factors. Some students are thinking these are the external environment is okay, internal environment is okay, but psychological factors are also, is the psychological factors is important to develop the homeostatic mechanism? Yes, my dear, because the psychological factors are that which produce the depression, the anxiety, the hesitation. So such kind stress, if in your social environment someone buy new bike, the bike is like 2.5 lakh and so on, but you are having only 1 lakh bike, so you feel depressed that I am not having that much efficiently bike, so my father is not good. So you feel depressed because nowadays the students or the children are depressing in very little bit things. I'm not having this dress, I depressed. I'm not having 80% marks, I depressed. I'm not having this, I depressed. I feel stressed, I this, I do that. In my time, in our time, we don't know the depression. Our parents will slap like, what is the depression? Like that they are behaving, and they are behaving still, also they are behaving same. Okay, so please just maintain your life and just do good things in your life. It's just aaj ka gyan. Sorry. Psychological factors are the factors which produce which comes from the social environment, social backgrounds, and they develop the stress, anxiety, depression. Like that factors we'll discuss here. Like comes from social aspects like depression, anxiety, stress, these factors. Okay, but these factors are okay, external, internal, and the psychological factors. But how our body deals with such factors? Our body is having feedback mechanism to maintain the homeostasis of its own. So homeostasis can be maintained by feedback system. Okay, so how can our body overcome such factors, either depression, either high BP, either high temperature? So our body having the feedback system, and through the feedback system it generates some chemicals, some hormones which leads or which normalize such factors and maintain and save your life. So homeostasis is maintained by feedback system. Homeostasis, I am writing here H dot. Homeostasis can be maintained by feedback system. The feedback system is just our body or our different receptors, senses just telling our body or our body central organs that the things is not good. If you are not normalize these things, you will absolutely getting some harm. So our body just run, and not like that run, our body hormones, our body chemicals and body other factors will initiate such factors or such chemicals, so our body can normalize high BP, our body can normalize that high temperature, our body can normalize the stress. So here the homeostasis mechanism can be maintained by feedback system, and the feedback system is of two types. It's either positive or negative. Suppose that in your college one new teacher came, and after one or two lectures the principal came and want to feedback. Means like high temperature came and your body want feedback that high temperature is outside, then what should I do? Then you students give the feedback, and like that our body senses give the feedback that this is the thing and this is good thing, this is the bad thing, you have to normalize this, you have to not, you don't touch these things. So like this, so that the feedback, it's a feedback is just like to tell something that the things is not going good. So here the things or the approach towards the teacher, it's either positive, you can give the positive feedback, it's if the teacher is up to mark, and you can give the feedback negative if teacher is not up to mark or not up to your level, so it's a negative feedback. So the body, same thing, our body senses give either the positive thing or the negative thing. Okay, so there are the two feedback system, it's either positive and either negative. The feedback system are of the two type, is positive and negative. So now we will discuss about the positive feedback system, negative feedback system and component of the feedback system. Now come to the feedback system. Feedback system is a cycle of events in which the status of a body condition is monitored, evaluated, changed and again re-monitored, re-evaluated and so on. Means the feedback system means in the feedback system there are the different events or the different process can be proceed in which our body status or body conditions can be monitored, can be judged and take the action. After taking the action, what changes will be produced, what changes are produced, that changes will be re-monitored, re-evaluated, and suppose that these changes are not that much sufficient, then again our body will do some procedure for maintain the homeostasis. So here the feedback system in the feedback system there are the different cycles of events occur, so to maintain the homeostasis. Okay, so I have written the definition here. The feedback system is a cycle of events in which the status of a body condition is monitored, evaluated, changed. Means the condition is monitored, evaluated and again some actions is taken, and after that action the body conditions again re-monitored, re-evaluated and so on. So on means if suppose that these changes are not that much sufficient, then again some events will be take place and then see the difference. So here monitored variables are here, each monitored variable such as the body temperature, blood pressure, blood glucose level and many others. So such variables which proceed, it's termed as the controlled conditions. Means the controlled conditions are maintained, must be maintained in our body, not should, it must be maintained in our body to maintain the homeostasis. So here each monitored variable such as, means what are the variables are monitored. So here the monitored variables are termed as controlled condition, like body temperature, blood pressure, glucose level, blood glucose level, that is. Okay, so here these variables are termed as the controlled condition. Okay, and any disruption that changes a controlled condition is called stimulus. Means any initiating or provoking factor which change such variables are termed as stimulus. Okay, so here I will write any disturbance which change controlled condition is termed as stimulus. Any disturbance which change the control condition is termed as stimulus. Here the three components. So this is the overall the feedback system, but we will discuss in brief, in very detail, the feedback system, the positive feedback system and negative feedback system. So don't worry about that. So here we will discuss about the component of the feedback system. There are three components: receptor, control center and effector. Receptor, control center and effector, these are the three main components of the feedback system. So if you have written all these things, so I will erase it out. So in the component. So there are the three components of the feedback system. Components of feedback system. One is receptor, second is control center, and third one is effector. For example, suppose there are too much cold or too much low temperature outside. So our skin will receive such low temperature. So this time the skin is the receptor, and the skin will send the impulses or the different factors which present in the skin. They send the impulses, means the temperature sensitive factors send the impulses to the control center, that is the brain. We will discuss the brain has the hypothalamus, pituitary, that will not the part of the discussion here. So here the skin receptors will receive the cold weather and they will send the impulses to the brain, and the brain will judge then what should I do to maintain the homeostasis or to maintain the body temperature at the 37.5 degrees Celsius. So here the maintenance, so the brain will send the skeletal muscles that start shivering. So you will start the shivering. So the brain send the impulses and the skeletal muscles start to shiver. The skeletal muscles are affected by this message. So here the skeletal muscle is the effector. So here the Skin is the receptor, brain is the control center, and skeletal muscle is the effector, which produce the shivering to raise the body temperature. So here we will discuss about the receptor, control center, and the effector. Now we will discuss about the components of the feedback system. There are the three main components. First is the receptor, second is the control center, and third, that is the effector. Here the first is the receptor. As the name suggests, recept means to get something or to receive something. Here I have written one line definition, who receive the changes. Here what is the something? Something means here the some variables like the body temperature, body glucose level, blood glucose level, blood pressure, like that. So here the receptors receive the changes, and these receptors are the body structure that monitor changes in a controlled condition and send impulses to control center. So after receiving means if suppose that the body, if the suppose the external temperature is too low, so our skin receive the impulse, receive the messages from the surrounding, from the outside external environment. So our body receptors means our body temperature senses receptors, temperature senses receptors बोल दीजिए, temperature senses receptors or the temperature receptors will send the impulses towards the control center. So here the variables, the changes in the variables are received by skin. So here the skin is the receptor. Now in the control center is an organ or the body structure which receive the impulses from the receptor. So here an organ or structure set the range of the value within which a control condition maintain. Means our control center maintain the range, means the body temperature maintain from 37.5, this is the range. Our blood pressure level 80 to 120, this is the range. So these ranges will decided by the control center, and these ranges are decided in terms that up to this level our body will not get any harm. Above this level our body started deteriorated. So here the control center decide a normal range, and after that range the conditions will be more critical. So here the receptor give the impulses or the send messages to the control center, and here the input it receive from the receptor and generate the output commands. And after receiving the impulses or the messages from the receptor, the control center will decide what should I do and what should not. So here if the skin is affected by the outer temperature and it receives the messages from the surrounding temperature, so the temperature is too high, then it sends the impulses to the brain. So here the brain will decide what should our body do or should not. So here the brain is the control center, skin is the receptor, and now the brain will decide that which organ I have to select to overcome such critical conditions. So here the control center send the output command or the generate the output command. Now that is the effector. Third, that is the effector. Effector, the body structure that receive output from the control center and produce a response or effect that changes the control condition. Means effector is the body structure which receive the output signals which decided by the control center, and after that the effector will generate will show the effect or will show the work that I am doing this, as that skin has the giving such responses. So on behalf of that receiving messages, I am doing this. So if the temperature is too low from the outside, so the skin will send the impulses to the brain. The brain is the control center, and brain will send the impulses to the skeletal muscle and they start to shiver. So here after shivering our body temperature automatically rises, And not only if the temperature is too low, only that shivering is, if the shivering is not that much sufficient, the brain or the control center will decide further more work. That will not, we will discuss here. We will discuss in the feedback systems. In these topics, we will discuss in the feedback system. So here the feedback system has a 3 component. One is the receptor, second is the control center, and third is the effector. So in the next video, we will discuss about the positive feedback system and the negative system with their important examples. Thank you.